KLIF News Time now 6:08. You may have seen the story that a former NFL player for the New York Giants, who died at a very young age of 27, was found to have a disease brought on by being smacked in the head too many times playing football. It's something that they call CTE, and here to talk about that is Dr. Alfred Johnson, an internist at Johnson Medical Associates in Richardson. Dr. Johnson, good morning.
Good morning.
Let's start off with having you explain what CTE is and what causes it.
Well, CTE is chronic traumatic encephalopathy, and it's caused by repeated blows to the head, which then affects the brain and causes changes in brain tissue, resulting in brain dysfunction. And so this is brought to light by the recent movie Concussion, and then by the numerous football players that have had traumatic brain injuries, concussions, and some of them not recovering, and like this case, where they eventually either overdose or commit suicide. And their brains have been studied and found that they have the scar tissue from these traumatic injuries in their brain, and this is found at autopsy.
Have you treated patients who have CTE?
I've treated patients with chronic traumatic brain injuries, yes. They may not be all football players, but the vets have this. Our veterans with the chronic, the percussive injuries, where they've been exposed to the IEDs, the bombs, the blasts, and it affects their brain, and they have chronic problems with it and end up with post-traumatic stress or just the brain injury as we see. So, yes.
This particular case we're talking about was the former safety for the New York Giants, Tyler Sash, found dead at the age of 27 of an accidental overdose of pain medications. He had not played for some time, and is my understanding that CTE can't be diagnosed. It can only be found at autopsy. Is that right?
Well, the confirming diagnosis. The symptoms associated with it is fairly straightforward, and people just have to be aware that when you have concussions, you can have prolonged effects from it, where you can have trouble with your memory. It can change your personality. It can have lack of motivation, many different symptoms related to brain function as far as just being able to focus. With Mr. Sash, he went to Iowa State, was a noted celebrity, but couldn't keep a job. He couldn't stay focused. And then he was just irritable and angry and upset all the time. So the message is, if you have a concussion, you want to pay attention to those post-concussion type symptoms and seek treatment. I do hyperbaric oxygen therapy on these people. Oxygen is the only medicine that really heals the brain. You're in a chamber under pressure, breathing 100% oxygen, which increases the oxygen to the brain 10 to 15 times. When you do this in a series, it helps those cells that have been damaged to heal themselves, and then the patient regains his function.
So parents really need to watch out for their kids who are playing in sports if they should get a concussion, because I guess it could lead to CTE in the future.
Exactly. And, in the football players' situations, it's the repeated traumatic injuries. It may not have to be a full concussion to really cause the brain damage, but it's the additive part of it. So when you see neurological changes like we talked about with mood, personality, focus, headaches, yes, you really need to pay attention to that.
All right. Dr. Johnson, thank you very much for helping us out this morning and understanding this story a little bit better. It's a terrible thing, and I expect we're going to hear a lot more about this.
Well, you're totally welcome, and yes, it makes sense to really pay attention.
Dr. Alfred Johnson at Johnson Medical Associates in Richardson.
KLIF News Time is 6:12.